Hey everyone, Paul from Ortho Eval Pal. What I want to do here is a lower quarter screen, okay? So basically screening out the lumbar spine. And as I said when I did the cervical spine, I like to follow a particular pattern. It's something I do with all of my patients just so that I don't miss anything. Now, of course I ask a lot of questions like, do you have any bowel or bladder problems? Does it hurt when you cough, laugh, or sneeze? Those can be a sign of some intrathecal pressure and inflammation around the dura of the spinal cord can cause them some discomfort. I ask them if they have it on both sides. That's a little unusual if you have nerve root compression. Nerve root compression is generally on one side. You get severe pain going down both legs, you need to be thinking of a huge herniated disc, cauda equina syndrome, or something of that sort. And so the red flag should go on a little bit if you have bilateral lower leg pain coming from the lumbar spine. So first thing I like to do is I like to check reflexes while I'm talking to the patient. L4, S1. Then I like to check strength, and so I'm going to get down here a little bit. I like to start with L5, extensor hallucis longus, hold tight. Same with this one, hold tight. S1, invert, hold tight. Don't let me push it out. Don't let me push it out. Lift the feet up toward the ceiling. L4, hold tight. Hold tight. Quads. L3, 4, hold tight, don't let me push. Good. Don't let me push. Good. I'd like you to lift this knee up off the table. L3, hold tight. This one up, hold tight. L3, great. I'll also, when I have them in this position, I always check their hip because I see so many patients who come in with back pain, and it's really not back pain. It's a hip arthritis, and if you just do internal rotation like this, they might lock up real quickly at about 5 to 10 degrees, complain of some groin discomfort and some low back pain. It's extremely common to see patients with hip arthritis and spinal stenosis of the lumbar spine. Okay, so keep that in mind. Most of these people have both, and oftentimes the hip will be a pain generator to the low back and cause some problems. Okay. The next thing I do is I just kind of chat with them, check out their range of motion, and see if they have a sitting straight leg raise test. If they can do 90 degrees in this position and I put them on their back and they can only do 30 degrees, red flags go up, and I'm really thinking about symptom magnification. Okay. The next thing we're going to do is we're going to check sensation. So we're looking at L4, L3, and then we've got 5 in the front, S1, heel and lateral foot. See if there's equal sensation there. And so that's my basic lower body screen. Sometimes I will also have the patient bring the chin to the chest. I'll extend the leg and I'll have them lift the head up, and if he gets relief, I need to be thinking that he's getting some real nerve root tension and some thecal pressure that is going on there, oftentimes just from inflammation, and that can cause some irritation there. So if I see anything unusual going on here, hyperreflexia or anything like that, I'll do check his clonus. I'll also do a Babinski sign with him and see if his toes are up going or down going. And so that is my basic lower extremity screen. And while I do that, I also kind of rule out the hip just to make sure that they don't have some sort of a hip pathology that could be giving them pain down the leg. Thanks.